If you're a hormone optimization specialist, especially if you've gone through BHRT training with any of these 3 CME organizations, that would include Worldlink Medical, A4M, also known as the American Academy of Anti-Aging Medicine, or IFM, also called the Institute for Functional Medicine, this video is for you. Stay to the end of the video and I'll let you know how you can get several valuable patient education tools specifically designed for hormone optimization providers like you, absolutely free. I'm Steve Goldring from simplehormones.com. I help patients and healthcare practitioners with easy to understand patient education tools. Most of those are about hormones and hormone optimization. In fact, I'm dedicating my professional life to supporting hormone providers just like yourself. I'm pretty familiar with 3 different CME organizations that emphasize hormones, hormone optimization, and bioidentical hormone replacement therapy, or BHRT, among other topics. The CME organizations I'm talking about are, first of all, Worldlink Medical, with their medical director and main teacher, Dr. Neil Rouzier. They've also had many other teachers and experts, including Dr. Jason Fung and Dr. Benjamin Bickman at their conferences. I worked with Worldlink for a number of years, and I've developed, I would say, hundreds of relationships with hormone providers all over the US and Canada and even some in the UK, as well as a few other countries. I earned an ABHRT certification from Worldlink. I also have some experience at A4M with Dr. Pamela Smith. She's a popular hormone-focused speaker for them. I earned a C4 HRT specialist certification from PCCA, which was sort of a partnership with A4M. I don't have as much experience with IFM, or the Institute for Functional Medicine. They have a number of hormone teachers and experts. I haven't been to any IFM conferences or taken their courses, but several of the providers that I know have been. I teach hormones and hormone optimization to patients because of the influences of Worldlink, Dr. Neil Rouzier, Dr. Pam Smith, and the hormone optimization providers that I've met through these organizations. My desire, my goal, is to provide resources that help nurse practitioners, PAs, and physicians, just like you, teach your patients about the life-transforming power of optimal hormones. As you probably know, the idea of optimal hormones is the idea of getting hormone levels that aren't too high, they're not too low, but they're just right. And when patients have optimal hormone levels, that allows them 2 different benefits. The first thing is that they can eliminate or at least reduce a lot of their hormone-related symptoms. But the second and maybe more important benefit of optimal or just right hormones is that they can reduce long-term health risks. Things like osteoporosis, heart disease, type 2 diabetes, Alzheimer's, even prostate and breast cancers. So in my many years of being around CME organizations and learning about hormone optimization, the one thing I noticed was that there seemed to be, especially in A4M and Worldlink Medical, a lot of evidence and some great science to dive deeply into, but I felt like there was a missing piece. The missing piece was an emphasis on patient education. Of course, every provider has their own take on patient education, and there were brochures and helpful books and some limited resources to assist providers with their patient education process. But as a pharmacist for over 25 years, I spent a lot of my time behind the counter counseling and teaching patients about all the ways optimal hormone levels were going to change their lives. In this journey of meeting hormone providers, I've had a lot of conversations basically asking the same question. What's the single biggest challenge, frustration, or difficulty that you face when it comes to educating patients about hormones? I'd love to know your patient education issues in the comments. Well, I've kind of boiled down the answers to those, and I've been able to help providers with solutions for several challenges that they've told me about. One of them is saving time for practitioners and their staffs, reducing information overload for patients, relieving patients' fears about hormones, especially women in menopause, helping patients recognize the ways optimal hormones accomplish those 2 goals that I mentioned, eliminating symptoms and reducing long-term health risks at the same time, providing clear, concise video content to explain hormones to patients, because providers, frankly, just don't have the time to make that content for themselves. using patient education to address pushback from primary care doctors and other providers who may not really get the concept of hormone optimization and may question what you're doing with their mutual patient. Well, I offer a comprehensive program of Simple Hormones digital patient education courses. These are specifically designed to help providers with these exact challenges. To learn more, click the link on this video that says Get Resources. You'll get access to a bundle of free patient education tools that include Menopause Misery's Blueprints. Those are downloadable PDFs that explain to women in menopause that the real problem underneath those symptoms isn't a Paxil deficiency. The root problem underlying menopause is the loss of hormones, specifically the loss of estradiol and progesterone, among others. I also have downloadable PDFs that explain how the normal reproductive cycle is supposed to work and the impact of low thyroid, high insulin, high testosterone, and ovulation and low progesterone on reproduction. I have 2 top 10 articles list, one for menopause and another for low T in men. They're handy references for what I believe are the 10 most important trials and reviews that all of us should be familiar with. If you really want to dive deep into the literature, I actually have more references, over 200 available in my PubMed Bibliographies on all kinds of hormone-related topics. My Simple Hormones YouTube channel with dozens of hormone optimization topics might be a resource you could share with patients. You'll get an opportunity to join my Simple Hormones Provider Database. The YouTube videos I mentioned bring in around 3 to 5 patients every single day asking for a referral to a hormone optimization specialist just like you. Well, I can't guarantee I'll find you new patients, but there's a chance. It doesn't cost you anything but a few minutes to fill out the practice information form. So whether you've been trained by IFM, A4M, or Worldlink Medical, or maybe all 3, the free bundle of tools I provide can help streamline your patient education process. I'll also let you know about my Simple Hormones digital patient education courses. You can decide for yourself if they might be helpful for you and your practice. If this video's been helpful, click the like and subscribe buttons, and you might also click the notify bell to make sure you find out whenever I post a new video. Thanks so much for watching, and I'll look forward to talking to you again soon.